Hi, I'm Russ Ornstein, and I just want to explain a little bit about the differences between different types of adjusting. I'm working on a type of adjusting where I finish the adjustment at a neutral position, and it is quite different than other adjusting, and I just wanted to kind of do a quick chart of some of the differences and how it's different. I'm not trying to say one is any better or worse, I'm just saying what the differences are, and I can explain later why I want to do it this way. So anyway, with diversified adjusting, the line of drive of diversified is either a rotational adjustment or a vector adjustment. So you're either rotating the joint or you're creating a straight line adjustment. Okay. With coupled motion, what we're doing is a rotational adjustment with a thumb, and you're doing a long axis stretch at the same time. With the neutral adjustment, the one I'm talking about it's a vector, so it's a straight line adjustment towards the midline. The starting point of each adjustment for diversified and coupled motion is at the end range. With diversified, you're taking the joint, say, into flexion, lateral flexion, and then the opposite rotation. With coupled motion, again, you're taking it to the end range, so that would be, say, right rotation and right lateral flexion, but you do take the joint to the end range before you adjust. With the adjusting to neutral, you're still very much within the normal range of motion of a joint. You don't go to any end range. Yes, there is tissue tension, but there is no end range motion. The finishing point of each adjustment, diversified and coupled motion, are in the paraphysiologic space. So again, we start at the end range of the joint, and then you take the joint a little bit further into the end range, into the paraphysiologic space. Also with coupled motion, you take it to the end range and you thrust into the paraphysiologic space. It's pretty much the way that most all HVLA adjusting works. With adjusting to neutral, we don't do that. So we're actually taking the joint back. You're putting a motion or a position in the joint, and then when you thrust, you're actually just thrusting the joint back towards a neutral position. So you finish the joint at neutral. So the joint never leaves the normal range of motion, and that's kind of one of the key components. But when I explain later how the motion works, or motion of the joints are working, what we're trying to achieve, it makes it a little bit more clear. And then coupling with diversified adjusting, it's an uncoupled adjustment. So, not so much with lateral flexion, it's arguable, but with rotational, with cervical breaks, yes, it's uncoupled. You're taking the joint into flexion, say left lateral flexion, right rotation, that's an uncoupled motion. It's going to be pressing the facet joints closer to each other on one side and gapping them on the other side. Whether or not that's a great thing for the joint is arguable. I think one of the key concepts of coupled motion adjusting, and one of the reasons I like it, is because the joint is moving in a coupled way. We know that the zygapophyseal joints are meant to work with rotation and lateral flexion in kind. So if it's a right rotation, there'd be a right lateral flexion. It's meant to work that way. We can see that. So when we're adjusting with coupled motion, essentially we're sort of honoring that. You're not gapping any facet joints, and that's one of the reasons why it's comfortable. It does change things very quickly. I find that there's a sort of a factor of 3 to 4 times faster resolving joint problems with coupled motion over diversified. So I'm not trying to say one's better or worse, but in my own personal experience, I find coupled motion is much more effective, 3 to 4 times faster resolving problems than diversified. With adjusting to neutral, again, the adjustment is a coupled adjustment, so there's never any uncoupling, and again, because it's in the normal range of motion, there's no sort of stress on the joints. We're really just zeroing in on the muscles that are keeping that joint from getting back to a neutral position. So we start the adjustment in a coupled position, so there'll be rotation and lateral flexion, and then we adjust it from the rotation, lateral flexion, take out the lateral flexion, and we adjust it back to a neutral position. Yes, there is still some rotation, but it's really just simply so you can hold the person's head. We're not changing the rotational component in the adjustment. It's just a taking out the lateral flexion that we're inducing in the setup. So you finish the joint at a neutral position. The reason that I like this is that it feels like it's much more in line with getting the joint to do what we want it to do. Obviously there can be lots of different problems in and around joints, and I'm finding that when I can get the joint back to a neutral position, I can clear a lot of the other problems very effectively. So what I'm finding in practice is that adjusting to neutral is actually turning out to be a lot more effective than the coupled motion is. So very often I'll adjust someone to neutral and I'll see them 2, 3 weeks, 4 weeks, even 2 months later, 3 months later, and the joint's still working perfectly. So really in one adjustment, we can see quite a lot of very positive changes. So I'm not trying to say that I'm better than anyone else or that this is better than coupled motion. I'm only saying in my personal experience that modifying my technique to adjust and finish the neutral position is definitely coming out with much better results. I'm fixing stuff a lot faster, people are coming back and they're not having the problems anymore. Yeah, it's working really well. So I'm going to do a companion video to this one about more of this, a little bit of a hands-on. I have a little model I can use to show the differences again with a particular type of issue. So if you're interested, just sort of click along, you'll probably see that video. I'll shoot that today as well, and I'll post them both up. So if you want to see more about the details of the setups of those, then click in on that. I really just here wanted to address what the key differences were between these types of adjusting, because I get a lot of questions about that. But anyway, thanks for watching. If you have questions or comments, please post them, and I'll look forward to addressing those in a future video. Thanks for watching.